It is very important to complete the schedule on time. You must tell the doctor about any adverse effects seen prior to immunization. Minor illnesses like mild cough, cold, loose stools, vomiting, or even mild fever is not a contraindication for vaccination. However, if a child is suffering from high fever, severe loose stools, pneumonia, or any other illness needing investigation or admission to a hospital, vaccination should be postponed till full recovery. OPV dose can be given during diarrhea, but should not be counted, and an extra dose in the schedule should be given. One can feed the child, including breastfeeds, before and after any vaccination. There is no need to starve the child before vaccination. Maintain the vaccination card properly and take it along during each vaccination for the doctor to see and record. After vaccination, keep firm pressure for a few minutes at the injection site with a spirit swab. Do not massage or rub at the injection site. Wait in the consulting room for another 30 minutes in case any reaction develops following the vaccination. Note down carefully the next vaccination date. Inform the doctor immediately if the child develops any reaction or abnormal behavior or habits following vaccination in the next few days. We have thus seen that care before and after vaccination is very simple. Now let us find out whether the child can be given more than one vaccine at a time, and what should be the minimum gap between two vaccines. More and more vaccines are recommended and available for children. Many of them overlap the age of recommendation. For example, OPV, DTP, HIB, and hepatitis B. All four will be required to be given at 6 to 8 weeks. Unless given on the same day, the schedule of all these vaccines will not be completed in time. Hence, one can and one needs to give these vaccines simultaneously. One can either use combination vaccines, for example, DPT and HIB vaccine in the same syringe, or give them on the same day using different syringes and at different sites. As time goes by, more and more combination vaccines will be available to reduce the number of pricks. Therefore, any number of vaccines can be given on the same day at separate sites, but if not given on the same day, there should be a gap of 4 weeks between two vaccines in general. One should not give one vaccine today, second after 7 days, and third vaccine after another 7 days. Extra doses of OPV, like in polio immunization or ring immunization, are notable exceptions to this rule. We have learned the type and time of vaccinations, but it is equally important to understand when vaccinations should not be given or taken. Patients with severe reactions to previous immunization should not receive the same vaccine again. Patients with progressive neurological disorders should not receive DPT, but instead be given DT injections. Patients with severe egg allergies should not be given measles or MMR vaccine. Patients with an immune-compromised condition, like symptomatic HIV or AIDS, should by and large not receive live vaccines, especially if a killed vaccine substitute is available. This, in a nutshell, tells us how important it is to get our children vaccinated. Children are a gift from God, and it is our duty as parents to protect them from the various viruses and bacteria causing diseases. Vaccines offer protection and help the immunity of a growing child. Let us do what we can to bring up healthy and strong children. Let us not fight vaccinations, but instead focus on fighting diseases. Your child's life is in your hands. Protecting it is not a choice. but the duty of every parent.